So first, let me start by apologizing for all of this. I understand completely that I look like a homeless lumberjack. But this is what Corona does. I'm not doing anything about this until I can sit back in a chair and have a young Turkish man sculpt my facial hair with a razor blade like a civilized human being. We all have to make sacrifices. So the other day I was having a conversation with my family and I told them that I had the perfect solution to this whole COVID-19 situation and that it was a crying shame that nobody would listen to me. To which my son pointed out I had never told anyone about my plan except for them, and there was nothing that they could do about it, so how could they possibly listen to me? To which I conceded that that's a good point. So I figured I have to at least put it out into the world. So then, when nobody hears me or pays any attention to me, I can self-satisfyingly say they should have listened to me. Which is really the theme of this whole channel. I muse and come up with ideas which I put out in the universe, which no one ever sees, and then I can be smug and self-satisfied about having thought about something without actually having to worry about any negative repercussions or pushback. It's really like self-therapy. Anywho, what's my brilliant COVID-19 plan? Well, let's start with what we know about this virus. We know it's a highly contagious disease. We know that this virus can spread via airborne particles and that it can live for a relatively long amount of time outside of a host. We know that it can survive for hours, maybe days, on a variety of surfaces, and that it can therefore infect people through a variety of ways. We know that it reproduces quickly once inside the host and can be shed or spread by the host, even if that host is asymptomatic. So in essence, what you've got is a bunch of people walking around, spreading the disease for days or even weeks without even knowing that they're sick. So that makes this a particularly nasty and unusual virus, because usually, from my understanding, a virus that is so highly contagious generally has a relatively low mortality rate. But we know that this virus has a relatively high mortality rate, especially among individuals with underlying medical conditions, so-called high-risk individuals, people with hypertension, heart disease, weakened immune systems, etc., etc. For those individuals, this virus can be especially dangerous and even deadly. And even if the disease isn't fatal for these people, those individuals are more than likely going to need to be hospitalized. They may need to be put on a ventilator to help them breathe. They're going to need a lot more care. And that's why we're doing what we're doing right now. That's why we're doing social distancing and isolation, so that the hundreds of thousands of high-risk individuals in the country don't all get sick at once and don't overwhelm the medical system, because that can lead to individuals having to die at home alone because we can't fit them into our hospitals. That's essentially what happened in Italy. But we also know that for young, healthy individuals, the mortality rate is actually pretty low. Children, for some weird reason, seem to get the virus and not ever really get sick from it. And most healthy people who catch disease will either have what is essentially a pretty severe and uncomfortable illness, which could last from a few days to up to a week, but others may have a very mild illness, and others are completely asymptomatic and don't seem to have any illness at all. So the bottom line is most healthy people who get this virus will not have to be hospitalized. They don't have to go on a ventilator. They wouldn't overwhelm the healthcare system. So given all of that, what's my brilliant solution? Well, I present the COVID-free islands, brought to you by Corona Cervezas. Okay, so I haven't spoken to the fine people over at Grupo Modelo. But if it was me, and I made a beer that happened to share its name with a deadly virus, I might be looking for all the positive marketing I can get. But then someone said to me, can they sue you for that? To which I said, I don't know. So that means that's the last time I'll be bringing up an international conglomerate, though I still think sponsorship would be a really good idea. But what is a COVID-free island? Well, if the problem isn't the population as a whole, but rather it's these high-risk individuals, then we need to create zones where high-risk people can live and the virus cannot get into these locations. If the virus can't get in, that way high-risk individuals will not be exposed to the virus. If they're not exposed to the virus, they don't get sick and they don't overwhelm the healthcare system. So if you're like my kids, the first thing you'll probably say is, okay, sure, but where are you going to put these COVID-free islands? So here's the plan. We take nursing homes, we take retirement communities, we take long-term care facilities, maybe empty hotels and resorts that aren't currently being used for anything, maybe even some hospitals. We take those facilities that already contain a lot of high-risk individuals, and we nationalize them. We secure them. In a partnership between the federal and the state governments, we take over those facilities. And when I say take over, I mean take over. I am talking a complete and total shutdown. I'm saying you activate the National Guard, you activate the reserves, maybe we need to call in some active duty forces. I'm talking you take 2 strands of concertina wire and you wrap that bad boy up. I'm talking about tent cities in the entrances with field hospitals staffed by doctors. Nothing goes in that isn't clean and sanitized and disinfected, and no person goes in without having at least 2 tests that show them as being negative for the virus. Food, supplies, all of it collected by the National Guard, cleaned, and delivered into the community. And these islands, these shutdown islands where there is no chance for the virus to get in, these are where high-risk individuals can go to be safe from getting this disease. Now, once again, if you're like my kids, you're probably going to say, yeah, sure, Dad. America's going to go and build a bunch of concentration camps, and I'm sure that's going to go over just fine. What's ever gone wrong with that plan? To which I say, 1, don't call me Dad. It's weird when you do it. Only my kids should do that. 2, bite me. Bite me hard. Because it's not a concentration camp. Okay? Concentration camps are meant to keep people in. These are meant to keep people out. The people who live in a corona-free island, they're the lucky ones. They don't have to deal with this virus. It's not a bad thing to be in these locations. It's a very good thing to be in this location. Plus, it's going to be completely voluntary. Don't want to go? Don't. No big deal. If you're in there and you don't want to stay, leave. Anyone can leave. Going out is not the problem. Just know that once you leave, you may not be able to get back in if people in your community start dying from COVID-19. Now, some people are probably going to freak out because they think the federal and state governments are building concentration camps. Sure, I understand that. But those people are not that bright. And we shouldn't let national policy during a crisis be dictated because people have conspiracies. And besides, these places will have to have outstanding Wi-Fi. We'll have to make sure that every place has great Wi-Fi because people living there, they need to be able to contact their families. They need to be able to telework. And if they can contact their families and they can telework, they can also contact CNN and Fox News. So if there was any funny business going on, the whole world would know. That would make sure that it's in the government's interest to make sure that these places are as nice and comfortable and enjoyable as is humanly possible. So I did say that the federal and the state government should work together to nationalize on a temporary basis some of these locations. That means that the government should pay whoever owns these facilities whatever they were making the week before they were nationalized. And the government should promise that when they leave those facilities in exactly the same condition as they found them. You know, take only memories and leave only footprints type thing. Okay? So by securing these retirement communities, these long-term care facilities, maybe some hospitals, we automatically are protecting the most vulnerable amongst us. But like I said, if anyone says, forget this, I'm out of here, that's fine. You can go live with your family, the government can put you up in a hotel or whatever. But it's very important that anyone who chooses not to be in these COVID-free islands assumes 100% of the responsibility and the risk for whatever happens to them in reference to COVID-19. So if you go out and get COVID-19 and die, neither you nor your family can blame the federal government, the state government, the local government, your hospital, or your medical system. You had a risk-free option that you chose not to take. And that's on you. But what about the people who are at high risk and aren't living in a retirement community or a long-term care facility or something like that? No problem. If you're worried that you're someone at high risk, you go to one of these islands. Once you're there, you'll be admitted into this tent city, the field hospital set up in front. You'll be checked by medical professionals. They'll test you. Once you've tested free, welcome to COVID-free islands. Ba-bing, ba-boom, you're in. But what about social distancing? What about how many beds? How many beds can we put in these places? How close can we put people? That's the beauty of this whole thing. You don't have to worry about social distancing. There's no virus. These are the only places on the planet where we know there's no viruses. Inside these facilities, you can have parties. You can hang out. You can do whatever you want because you're not going to get coronavirus. So we can put beds in community centers, in gyms, in retirement communities. People will open up their homes to individuals who need a place to stay during this crisis. We need to figure out how many beds we need and how many risks there are and spread that out throughout the country. But I'm positive that we can do that. It's not going to be a problem. Yay, no more social distancing. And by the way, this is a huge bonus. Just a big, giant check mark in the plus column for this whole plan. And that is, the sad reality is one of the most devastating, one of the most deadly things that the elderly face is not cancer and it's not heart disease. It's loneliness and a sense of uselessness. Studies have shown that loneliness is just as devastating to the long-term health and mental capacity of the elderly as any other physical disease that you can get. And with this plan, the elderly become national heroes. They're sacrificing their homes and their places so that everybody can stay safe while the rest of the country gets back on track and opens up. And not only will they be heroes, but what you're going to be doing is you're going to be introducing a lot of younger people who otherwise never would have met or had relationships with this other demographic. Young people are going to be forced to live with and interact with an older generation, and I can guarantee that relationships, special relationships, are going to be forged. And people's lives are going to be changed for the better forever. Imagine a younger person who has the opportunity to find out what it was like the first time someone saw Martin Luther King on TV, or talks to someone who was unable their entire childhood to go into a restaurant because of the color of their skin. or someone who finds out what Woodstock was like from a first-hand account, or what it was like to follow the Grateful Dead around in a VW bus. That's going to be special. And yes, sure, being cooped up with a bunch of strangers is going to be stressful. But you know what's more stressful? Being cooped up alone, indefinitely, as you slowly lose your mind watching Netflix. That's worse. But what about the staff? You may be asking, what about the staff, right? Because if someone's going to have to staff, we're going to need to, change sheets and bedding, and the elderly people still need help, medications, all that kind of stuff. What about the staff? If they leave and they go home, they could pick up the infection and bring it back. Yeah, staff can't leave. Or at least they can't leave every day. I'm envisioning a system where the staff would be deployed essentially to their locations for maybe a week, 2 weeks, 3 weeks at a time, right? Because if you need to test everybody before they go into the center to make sure that they don't have the disease, it just wouldn't be practical to be swapping out that staff every day. And some people might say, aha, that will never work. You're never going to get a bunch of people to volunteer to be sequestered with a bunch of strangers for potentially weeks at a time. I'm not worried about that either. Plenty of people will volunteer for that. I read an article in the New York Times that said when New York City put out a call for volunteer nurses and doctors at the very zenith of the crisis, at the most dangerous point in time, more than 90,000 people, more than 90,000 doctors and nurses across the country raised their hands and volunteered to come help out in New York City. Americans stand up in a crisis. And besides, staffing levels in these facilities actually could be reduced. You're not going to need as many staff as you normally would because remember, now you've got a bunch of healthy, able-bodied people in these communities who can assist with daily living conditions, that can assist with daily activities. And so there should be plenty of people to help out. And besides, if you're a younger person who doesn't have an underlying condition, but you're still concerned about the coronavirus, guess what? You can volunteer to go to these facilities. You're safe and you're doing a good thing. So I don't think getting enough volunteers to staff these facilities would be a problem. I think that's the least of our problems. A much bigger concern to me would be the logistics of the whole thing. How do you come up with a database to be able to track these people, come up with rotation schedules, make sure everyone gets paid? That would be much more difficult in my opinion. And hopefully there are some Silicon Valley tech companies that would be willing to step up and help the government in that area. So that's it. That's essentially my idea of COVID-free islands. I think that's a good idea. I hope that you agree that that's a good idea. But you may still be asking, but what about the rest of us? What about other people who aren't in the COVID-free islands? And for you, I've got some good news and some bad news. The good news is social distancing is over. Yay! Take off that mask and throw it in the fire. Go back to work. Go to the movies. Go to a restaurant. Kiss, hug, and shake hands. Enjoy communing with your fellow man once more. Okay, the bad news is you're going to get sick. You may potentially get very sick. Not only are you going to get sick, but we need you to get sick. We need the rest of the population, those who are at less risk of dying from this disease, we need them to get sick from it, and we need them to recover from it. We need to get to what's called herd immunity. And if you haven't heard, if you don't know, herd immunity is when the majority of the population has been exposed to an illness, their immune system already recognizes and tracks that illness, and so they can't get it or spread it to other members of the community. And once we have achieved that herd community, the sooner we've achieved that herd community, then the sooner we can close all the COVID-free islands and everyone can go home. And that may sound scary, telling people that you're going to get sick. But for the vast majority of people, you'll be fine. It'll be great. Some of you will have mild or even no symptoms at all. Some of you may get very, very sick and life will suck for a little bit. But eventually, you'll get better and you'll be okay. But some people will continue to die. That fact is unavoidable. Some people, even anecdotally, someone who was young and had no idea of any underlying conditions will die. You'll hear stories of a 34-year-old or a 23-year-old who succumbed to the disease and died. And that will be very, very sad. But it will also be acceptable. We all die eventually. And try as we might, we have not yet achieved total domination over the forces of nature. And every time we think we're getting closer, Mother Nature throws something like this at us. So yes, some people will die. But you have to look at the numbers, at the statistics. And I know that your mother or your father, your son or your daughter, they're not a statistic. But every single year, every single day, thousands of our mothers, our fathers, our brothers and our sons, our sisters and brothers die. We die from car crashes. We die from disease. We die from having your bungee cord snap when you jump from that bridge. But the question we need to ask is, what level of action should the government take to keep the majority of individuals safe? And having COVID-free islands protects the majority. It protects the system, and it brings the overall threat level down to an acceptable level. It may be sad that there's no way to protect 100% of people from everything, but there's not. And maybe there shouldn't be. Okay. I know that's a little bit of a downer, but you don't have to worry about it. I heard from a guy on TV, he said, you probably won't die. But one more thing that I would like to suggest for the general population as we race towards this herd immunity, I think that the government should provide at least 14 days of paid sick leave for individuals who are not provided sick leave through their employers, or are not provided 14 days of sick leave through their employers. So that if you do get coronavirus and you do get sick, one, you can't be fired, and two, you would have your normal pay so that people can stay home when they're sick without having to worry about their rent or buying groceries. And then you may say, some people may say that some people will take advantage of that and they may get some money they don't deserve. And while that might be true, face it, it's not that big of a problem. For one, the vast majority of people are honest and do the right thing. And second, if you do try to go and get 2 weeks of free paid when you're not sick with coronavirus, and you get sick later with the coronavirus, you can't go back to that well, and then you can be fired. So having that safety net there for the likely situation when you get coronavirus would be more important and more valuable to you than just trying to take advantage of the system. Which brings us to the matter of cost, because boy, this is going to be expensive. This idea of COVID-free islands would cost billions. Hell, it's going to cost hundreds of billions. To which I can only say, you're welcome. Because I never thought I would say hundreds of billions of dollars is cheap. But hundreds of billions of dollars is cheap because right now we are spending trillions. That's a number you shouldn't be okay with. That number should blow your mind. Trillions of dollars that we're spending right now is not acceptable, and in no way is that sustainable. So a plan that only cost us hundreds of billions of dollars, you're making money on the deal. In fact, I'm stocking them deep and selling them cheap. You're losing money if you don't take me up on this deal. So Anywho, just thought I'd put that whole thing out there. I know it's not going to happen. I know no one's going to see this, and if they do, no one's going to think I have a good idea. But I think it's a good idea. So, who knows? Who knows? Maybe the next time we have a global pandemic, this idea take hold. But in the meantime, if anyone is watching this and anyone does ever see this, stay safe, stay healthy, and for the love of Pete, until we do have COVID-free islands, brought to you by Corona Cerveza, stay home. Ciao.